Hi, this is pharmacist Curtis Alexander. In today's video, what I'm going to talk about is the side effects that you can see when you take propranolol, otherwise known by the brand name Inderal. Now, before we get into the side effects, it's important to understand when you take propranolol what's happening. It will help you understand why the side effects are happening. So propranolol is what we call a beta blocker, and you have beta receptors in different spots in your body, but primarily you have beta 1 receptors in your heart, beta 2 receptors in your lungs. So when you're blocking those receptors, we tend to see heart and lung related side effects. So that's kind of what's going on with propranolol. So the end result of what it's doing in your body, we'll see a decrease in heart rate, we'll see your blood pressure go down, we see decrease in the contractile quantity or the contractions in the heart, and decreased oxygen demand as well. Now, let's hop into the side effects. So first and foremost, again, because propranolol acts on our heart, one of the things we become concerned about is it causing arrhythmias in the heart. And so if you have a history of arrhythmias, if you have a history of any sort of heart disorder, but particularly arrhythmias, you're probably not going to be able to take propranolol. They may have to find something else for you to take. The next thing we worry about is going to be bronchospasms. Again, this is going on in the lungs. So anybody with chronic obstructive pulmonary disease, COPD, or if you have asthma, it could exacerbate it. It can make it worse if you're taking propranolol. Now let's get into some of the CNS. This tends to be this fatigue. The blahs is what we call it. Tends to be very common in people who take propranolol. When propranolol, again, it comes into your body, it's decreasing your heart rate. You don't have as much blood flow. So we get some of these fatigue side effects. We can also get insomnia, vivid dreams, even depression. And people will ask, well, why is depression happening? And the truth is we don't really know for sure what may cause it. What we think is there may be beta receptors in the brain that are affected by propranolol. But the bottom line is if you have a history of depression, anything like propranolol is going to be a little tougher to deal with. The other concern we have is if you're diabetic or say you're pre-diabetic, propranolol can come in and actually mask or hide if your blood sugars go too low, if you get hypoglycemia. And what's going on is that propranolol can actually inhibit liver gluconeogenesis. That's where when your sugars get low, if your liver doesn't have enough glycogen, your body can kick in stress hormones and tell your liver, tell your body that, okay, we're low, we need to make more sugar out of other things to get the sugar levels up. But propranolol can actually block that process. And so what you get is you won't have the signs and symptoms readily apparent when your blood sugars go too low. And really what it's revolving around is the sympathetic nervous system, your body's backup response is to kick in the stress hormones, make the sugars in a different way, and it has a tough time doing that with propranolol on board. The last thing and the most important thing is people will withdraw propranolol too rapidly, and they can get some pretty serious side effects from that. So it's always important that if you're going to stop propranolol, if you and your doctor talked about that, you have to do it slowly. Because what happens, think about it this way, if you've had propranolol blocking the beta receptors in the heart, and so it's not getting some of the sympathetic nervous system, the adrenaline and stuff that tell the heart rate to go up, if it's blocking that, and so your heart rate's down, your blood pressure's down, and then you rapidly pull the propranolol away, you're going to get this influx of sympathetic nervous system, of this adrenaline-like hormones, and it's going to cause the heart rate, your blood pressure to rapidly shoot up. So we have to do it slowly. So those are, the main side effects I would look out for. Propranolol does help a lot of people, but because of its broad effects on the beta receptors, it's not just hitting one group, it's hitting multiple groups. We do see side effects. So If you have questions, post them in the comments. If you have other videos that you'd like me to cover, medication, supplements, whatever it might be, let me know in the comments. I promise I read them all. As I do more videos, it's harder for me to respond to them all, but I do promise I read them all. So again, propranolol side effects. I hope this was helpful, and until the next video, thank you.